This is a 19-year-old female presented with subluxated lens in her both eyes. This is the preoperative refraction. In such a challenging case, the surgical plan was to use the Capsulaser machine to create the capsular, followed by Siani ring fixation to the sclera, using flanged 6-0 proline suture. Dispersive viscoelastic was first injected to support the anterior vitreous, and to prevent escape of the capsular blue dye into the vitreous, which would affect the red reflex. The dye was injected and left for 1 minute. The iris hooks was used to expose most of the anterior capsule of the subluxated lens. Then the 5mm capsular was created. The iris hook was then used to hang the bag, followed by irrigation aspiration of the soft nucleus. Passing a 30-gauge needle, 2mm behind the limbus into the sulcus, with paying attention not to injure the bag or the zonules. A 6-0 proline suture was passed through the lumen of the needle, and the other side of the suture was passed through the eyelet of the Siani ring, followed by flange formation. The Siani ring was inserted into the bag, followed by implanting a 3-piece IOL. The outer flange was created to be left in the scleral tunnel under the conjunctiva. Finally, irrigation aspiration was done with stromal hydration of the incisions. This is the final postoperative refraction and best corrected visual acuity. Thanks for watching.